Deputy Prime Minister Lawrence Wong says sections of the after-action review on the government's COVID-19 efforts must remain confidential, and that's because the information contains national security and commercial sensitivities. Mr. Wong was replying to the leader of the opposition who asked for the report to be made public. The report was done by former head of civil service, Peter Ho.
I maintain the position that we don't know what we don't know. We do not know what is stated in Mr. Ho's report and the AARs from the respective ministries, and it would be important, in my view, for Singaporeans to consider the details and the breadth of perspective secured from all who participated in the various AARs. I hope this information can be made available to the public at some point.
Peter Ho's report focused on lessons for Singapore in crisis management. It included details like the internal workings of the government, our crisis management structures, and these internal workings and crisis management structures are not just to deal with a pandemic. The same structures are used for dealing with external security threats. And then there are other parts of his report which went into commercial sensitivities. If we redact all of these sensitive materials, we will essentially end up with the lessons for the government which are already in the white paper.
Questions were also raised on how a large number of developed and developing countries were able to start vaccination exercises ahead of Singapore. Health Minister Ong Ye Kung says that this was due to not being in a priority market for vaccine makers. Despite that, Singapore was still able to use its connections with the companies to get vaccines before the rest of Asia.
I believe our first vaccination occurred on December 30th, 2020. It was a nurse, I believe, a frontliner nurse. Based on a quick search, at the time, actually a large number of developed and emerging economies had already commenced their vaccination programs, many with mRNA vaccine. So just to clarify, did our vaccination program commence substantially after we procured? And if so, why the delay?
We are the first in Asia. We leverage on relationships with the pharma companies, particularly EDB. We're able to be high up the queue, outside of the EU, outside of the Americas. There is no reason for us to delay. Absolutely no reason. We're racing against time. We have danger at our doorstep. At the earliest possible juncture, we deliver the vaccine safely, efficiently, quickly to the arms of our people.
Mr. Ong also explains the logistical challenges in acquiring and transporting doses of COVID-19 vaccine. He says that Singapore had to set up new machines that could keep it at sub-zero temperatures in transit and its short shelf life once opened. It addresses a previous question on why the Health Ministry did not distribute the vaccines through clinics at the time.